So quickly trying to look at metabolic syndrome. All right, metabolic syndrome is usually when there's like an imbalance in what electrolytes in the body and all of that. So if it occurs in pregnancy, what is the effect of this on the baby? What is the effect of this on the mother? So for metabolic syndrome, it's just a cluster of interrelated conditions. All right, all these issues could be heart problems, could be lipid disorders, could be hypertension, could be type 2 diabetes, could be dementia, could be cancer, could be polycystic ovarian syndrome, could be non-alcoholic fatty liver. So any of these issues that could actually distort how the electrolyte balance in your body is going is a metabolic syndrome. Okay, so things like what obesity, hypertension, dyslipidemia, insulin resistance, of course that's what type 2 diabetes mellitus. So they significantly increase the risks of what adverse maternal issues and also the issues on the baby. All right, so though pregnancy itself induces metabolic changes, if it overlaps with like you had these issues before, then pregnancy is coming to add on it, you understand? So the issue is now further exaggerated. So to diagnose the metabolic syndrome, first of all, you just have to do a testing for some basic things like basal body mass index, triglycerides. That's basically to point out if there's lipid issues. All right, then high density lipoproteins, fasting glucose, blood pressure. So if any of these issues, if any three of this is found in a pregnant woman, that means she actually has a metabolic syndrome. Okay, so the risk on the mother is she can have gestational diabetes mellitus. Right, she can have all those hypertensive issues in pregnancy. Then sometimes it might lead to the baby becoming so big or the mother being too weak to deliver the baby through the vagina, so you have to opt in for cesarean section. Then postpartum metabolic disorders, that's after you give birth, the issues still persist. Then in the future she has the risk of developing heart issues. All right, so on the baby, if it is most of the times diabetes, it makes the baby so large. All right, that's macrosomia. Preterm birth, you give birth to the baby before the baby is matured. Neural tube defect, stillbirth. All right, neonatal hypoglycemia, the baby doesn't have a lot of glucose and all of that. So later on, the baby has a risk of developing obesity or type 2 diabetes again. So diagnosis is basically is challenging. This is because most of these issues, a normal pregnancy will bring them up. Do you understand? So sometimes you have these issues overlapping with pregnancy and it's hard for you to dictate, you understand, because you are feeling a woman is having those issues because of pregnancy. All right, so management strategies is what preconception counseling for women. So basically women should know that these issues exist, so that they can prevent it if it is preventable. Nutritional guidance, so what she's eating is actually a key. Monitor glucose levels, monitor lipid levels, monitor blood pressure. Then screen for any of these disease conditions in early stages of pregnancy.